Hi everyone, welcome to Center of Balance Live. I'm Szenan-Balance from Center of Balance, the acupuncturist. Now today's topic we're going to talk about hypertension, which is high blood pressure, right? So a lot of people suffer from high blood pressure, and that is very common, very common. Now today we're going to talk about what is high blood pressure, what is a normal reading of high blood pressure. Then we're going to talk about apart from that, what sort of symptoms, condition that hypertension, and maybe you suffer from hypertension. Then follow on, I'm going to show you some acupressure point that you can work on. If you're an acupuncturist, hey, those points that you can work on as well. And you can directly put needle on there. If you're not an acupuncturist, you suffer from high blood pressure, this is something that you can do for your own, to control your high blood pressure. Then if you're watching this live video right now, please give you a thumbs up. And I'm doing this live video every day, and if you have any question at all, if you have any requirement of, if you are sick or you suffer from any disease and you would like some acupressure point advice, please leave your comment down there and let me know, and I'll organize that topic for you, a live video. And if you're watching this live video right now, please tag the person that you wanted to watch this video. Just tag it on Facebook and get a name on there, and or share this. Simply just share it on your social media. All right, that's it. Hi Lu, Lu ni hao. Now let's talk about high blood pressure. Okay, high blood pressure, or what we call hypertension, right? It's when your pressure increase to unhealthy level. Now, what is the healthy level? It's less than 120 over 80, right? Anything that over 120 over 80, and that's abnormal, right? So your blood pressure measurement takes into account how much blood is passing through your body vessels and the amount of resistance the blood meets while the heart is pumping. Simple, right? So if the arteries narrow, like become much narrow, and the narrower of your arteries are, and the higher your blood pressure will be, right? So which means the blood go through the artery, right? It goes through an artery over here. It's like a pipe. If the artery is like a pipe, it becomes tighter and tighter, more smaller, not much space for the blood going on, and the pressure from the heart and the blood still the same. So what happened is the pressure in the pipe is gonna be higher. That is what we call high blood pressure. So it's very simple to get the idea right in your head, right? I hope you understand. I just pretending this is what we call, like this. If the pipe is about this is like putting needle in here, is about that big, and the pipe is about that big. So which pressure and the same amount of water go through this pipe and this pipe, which pressure will be stronger? That one will be higher because this is smaller. Simple, right? Yeah. So hypertension is very common. Really, you can ask around in your family, your neighbor, your friends. A lot of people suffer from hypertension. So in fact, in 2017, in the America government, they actually the standard of they try to bring down the high blood pressure standard. So which more and more people will put on drugs because of the standard change, right? So so hypertension typically develop over the course of several years. So you don't get it just straight away. It actually has been happening way back few years. Lead up to until you get it. Okay, usually you don't notice any symptoms. Usually when you get hypertension, you don't get any symptoms. But even without symptoms, high blood pressure can cause damage to your blood vessels and organs, especially the brain and heart and the eyes, as well as kidneys. Right? So early detection is important. It's very important. So regular blood pressure reading can help you and your doctor notice any changes. If your blood pressure is if you find out that much early, your doctor may have you check your blood pressure over a few weeks to see if the numbers stay the same or fall back to normal levels. So I've seen some patient that he came to me and they say that they put on high blood pressure tablet. I said, when did you find out? I just said, just last week. Okay, so how many time have you been measured? How long have you been measured? Is it just once? That doesn't make sense. So apparently some people miss out. They didn't know that you can't just you don't just go to your doctor and get your blood pressure and just one time, one off blood pressure is higher than 120 to 80, and then you're on drugs. No, that's not right. Okay, you need to measure at least 3 times, and you get all these 3 times, put it all together and divide it for 3, and see how well they what the results. Okay, so you need to take account into whether you're in pain, because if you're in pain, you raise your blood pressure. Whether you need to think about it, whether you're very stressed or anxiety, depressed. Okay, all these things then bring up your blood pressure. Blood pressure is a symptom, it's not a disease. Okay, so you need to keep in mind of this. So most people will think of this way. Okay, most people or doctor will think of treatment for hypertension, high blood pressure include prescription medication and healthy lifestyle change, right? So I want to let you know that this is a bit different in my opinion. All right. So I think blood pressure is a symptom. It's not a disease, and you need to find out what really causing it. All right. So changing lifestyle is the number one thing that you should do when you come to high blood pressure. But prescription medication, I really doubt it, to be honest. But I'm not. When patients come to me and they want to come up with medication, I say, well, yes, we can do that, but I'm not the person who be able to stop your medication. To be honest, even on the internet, I have to tell you this. Okay, you have to consult with the doctor. But I hold in my own opinion is my idea is no one need medication, right? So we need to check really to trace where your blood pressure come from. Then therefore we'll be able to know what's causing it. So and then we can change what's causing it and get rid of it, so your blood pressure will become normal. So that's what we're gonna do. Okay. So one thing that for acupuncture and acupressure and Chinese herbs to do is get the organs balanced, because we believe one of the biggest problem that causing high blood pressure is the organs function imbalance and your diet. Whether you stress or not, and all this factor we need to take into account, right? So we don't agree with medication, prescription, and we have a way to get patient with acupuncture treatment and Chinese medicine for a while, and we measure the high blood pressure. Look at the reading. If the reading is quite stable, then we want the patient to go back to the doctor, to the GP, and discuss what is the best way to slowly cut off high blood pressure tablets. Okay, so this is the way that we do. Okay, so high blood pressure increase. We know high blood pressure increase the risk of heart disease and stroke, right? We talked about just now, and it's a hypertension risk factor, including like obesity, large, and drinking too much alcohol, smoking, and most people or doctors will agree with family history. And I would say yes and no. Why do I say that? Yes, there is family history because of the diet habit. Yeah, because of when things happen, how you react to it, and that's how it causes you stress. But people will put it down to that is because your dad or your mom or your grandpa suffer from hypertension and you are on a high risk. Yes and no. Yes, because we think this is because you get the same habit of your diet. All right. So if your parents, your grandpa, grandma, they suffer from high blood pressure, and then you really, really want to do is check your diet. So change your diet, and that you have a bigger chance to change your health and to avoid high blood pressure. This is my opinion. So what is the most common treatment for hypertension? Of course, medication, prescription, beta block is more common, right? But again, we help our patient to remove the medication by through acupressure point and changing diet and control emotional as well as Chinese herbs and acupuncture. Hi, Carol, how are you? I didn't realize you're here. That's great. So now we have someone on YouTube and said, I think root cause of hypertension is stress. So should be work on stress reduction by acupuncture with diet management. That's great. Yeah. So one of the biggest issue, the factor of hypertension is stress. Okay. One of the stress. Okay. Why I won't say this is more mostly because of stress, because it can be diet, it can be stress, and when it's long time stress and diet out of balance, it causes organs issues, organs imbalance, right? So therefore, when we treat it, we need to treat when acupuncture and Chinese herbs, when we come to the treatment, we need to balance the organs. When you balance the organs and the change of diet and manage the stress, then yes, eventually we will look at it. The blood pressure will become stable and stable and stable. All right. So the other that we found that of course there are primary hypertension and secondary hypertension, right? And the secondary hypertension, it can be from gallstone or kidney stone, and that is something that we can get rid of it. Then the blood pressure will be normal, right? So if the blood pressure is causing from cancer, high blood pressure causing from cancer or other problem, then treating the cancer is the best thing to do, right? All right. Let's keep going. We're gonna talk about what the symptoms of high blood pressure. So, what is the symptoms of high blood pressure? Well, very, very common. We know one of the most dangerous aspects of hypertension is that you may not know that you have it, right? You may not know. In fact, nearly 1/3 of people who have high blood pressure don't know it. Yeah, they don't know about it. Okay. The only way to know if your blood pressure is high is through regular checkups. Yes. But it's not so convenient. You don't have to go to the doctor. You can buy a digital one, and they're quite accurate. Okay, they're quite accurate. You have to buy the good one. They're so it becomes cheaper now. Right now, this is especially important if you have a close relative who have high blood pressure. Yes, it is. Family, run family. Then you have to check it even regularly because you're on the same diet. When a thing happen, And if your father become very stressed, and when things happen, they don't know how to deal with it, and you're gonna become the same. You follow your father, you know, how to react to things, you know. Yeah, that is how we call from generation to generation, pass it down, right? How you deal with things, how you eat things, right? If your blood pressure is extremely high, okay, there may be certain symptoms to look out for, okay, including severe headache, right? Severe headache, right? Some people come in with headache. Now we take the blood pressure first, because it may cause by blood pressure, high blood pressure, okay. But again, headache can cause blood pressure as well because you're in pain. Fatigue or confusion, okay, version problem, right? Chest pain, difficulty breathing, you know, difficult to breathe, irregular heartbeat, blood in the urine, okay, pounding in your chest, your neck, your ear, right? All this thing, it may be the symptom of your high blood pressure. But to be honest, not everyone the same. Some people come with neck pain, just neck pain, always a neck pain, and that is because the blood pressure a bit high. And when you get the blood pressure lower or stable and the neck pain's gone, what's causing it? A lot of time with this is because they're working too hard. They have a lot of stress. This we see a lot in our clinic about this. All right. If you have any of this symptom that I just mentioned, see a doctor immediately. Yes, you need to see a doctor immediately, right? You could be having a hypertension crisis that could lead to heart attack or stroke, right? This is important. So untreated hypertension can lead to serious diseases, including stroke, heart disease, and kidney failure and eye problem. Okay, we mentioned that again, right? So watch out your diet and stress. Very, very important in this case, hypertension case. So now, what can we do about it? With acupuncture, with acupressure, what can you do about it? Right? If you're an acupuncturist, hey, magical aid is one of the strategy that we use. Okay, you can put on Bai Hui and Shi Shen Cong as well. And this is one of the strategy that we use commonly. Okay, and you need to test out whether it works or not. You need to run by look at your patient whether it suit that condition or not. Okay, they are medical 12 as well, but today we mainly want to introduce you the 3 points, which is come to the what we call 3, 2, 1 acupressure point. 3 is 3 acupressure point. 2 is 2 legs exercise. 2 legs exercise. Hi, Damoda from India, right? And third one is breathing, abdominal breathing. The reason I want to introduce this 3 acupressure point is because those 3 acupressure point can balance all the organs by just doing it yourself. And then this method is created by one of the scientists, and he's not actually an acupuncturist, but he got sick himself, and he was the person who ran the site and to prove that the meridian exists in our body. Then he was very, very sick in Beijing. I think he is 90 something years old. I think probably 100 years old right now, and he practiced it himself. And he introduced to a lot of people, and a lot of people use it for hypertension. It actually helped them decrease the hypertension. In the end, they don't longer need any junks. So I personally very, very recommend that all my patients, all of you, to follow this and do it every day if you suffer from high blood pressure. Now, again, I'm not claiming that all this thing that when you do it, you don't need to take your blood pressure medication, because what we do is if you come to me and I treat you with hypertension, and I don't directly stop any of your medication. We actually talk to patient and get our patient to change diet and de-stress and do the acupressure point that I'm going to show you later on. and as well as having acupuncture done in Chinese herbs. Okay, some case we don't do acupuncture, we just do Chinese herbs, and then we watch over a month or 2 months and look at the blood pressure, whether it's high or not. We need to measure it. You know, some patients they take it 3 times daily, and we look at the measurement. And if everything's so stable, then all my patients, I don't stop the medication at all. I don't suggest it because I'm not a doctor. I'm not in a position to stop them. It's a prescription. They have to go back to the doctor and discuss what is the best way for them to slowly cut it down. All right. So the doctor need to give them a way. All right. So this is how I work to GP. And yes, our patient really regularly stop slowly, not regularly, slowly cut off the medication until they weigh off completely from the medication, and they keep going with Chinese stuff for a while. When everything's fine, everything's good, then we slow down the Chinese medicine and completely slow down and completely stop. Then the blood pressure will be still perfect, and that's good to go. And then they just have to come in once every 6 months or once every year, something like that, to monitor the organs function to see everything's fine or not. And they keep going to do the acupressure point, right? This is how we treat hypertension in our clinic, right? In my experience. So I'm going to show you some point that will help hypertension that I show my patient. The first point is Hergu, which I showed to you already in the past. So use your thumb over this, and to match when you hand in this finger and thumb open up and match that line, and where your thumb is, and this is the point, right? So you just need to press it for 1 minute. Right? So this is not treating pain, it's not for headache or something like that. So normally I would suggest you straight away go for 1 minute. All right, just press it at 1 minute. Okay. The second point is over here. 3 fingers on the palm side, on the forearm, 3 fingers from here down to here. So on this level, I introduced in the past that we have 9 points over here, but mainly you just do 1 point, which is over here and between the tendons, or outside the tendon, on the other side of the tendon. Get the most sensitive one. You know, get the most sensitive. You can go up a bit, lower a bit, and find out the most sensitive one. When you hit the most sensitive one, then give it 1 minute. Okay, just need to do once a day, just once a day, 1 minute, once a day, 1 minute. And the third point is, you see that I actually introduced this in a lot of video, because this really works, because it can help all balance all the organ function. So on the kneecap, under the kneecap there is a tendon. So both sides of the tendons you can find a hollow. We call knees eyes in Chinese medicine and acupuncture. So on the knee eyes, on the external one, which is closed on both sides, you have one hollow, right? On the outside of it, which is little toe side, on that one, little toe side, 4 finger below that, and there is 1 point, just 1 finger, that finger distant out of the bone over here. 4 finger down, 1 finger distant, and over here we call stomach 36, Zhu San Li, and try to get a point that is very sensitive. 1 minute on that point, right? Just press it and rub it for 1 minute. If you're an acupuncturist, you know those 3 points are on Magical 8. Okay, Google it, you'll find it, Magical 8. Okay, I have a video for it, Magical 8, or Magical 8 plus 1, and those points, when you do Magical 8 plus 1, you are actually balancing all the organs. Right, it's a great way to treat for what we call hypertension. Okay, this is one of my strategy. I have other strategy as well. So you can do scalp acupuncture, you can do this, and make sure that when you treat, if you're an acupuncture, when you treat your patient with hypertension, you always show them those 3 points. And this is 3 point. 2 is 2 legs exercise. 2 legs exercise, you can get them to walk every day, you know, for 15 minutes, half an hour, or 1 hour, 60 minutes, half an hour, 15 minutes, depending on how well they can do. Okay, to or I have a video that online that you can do swing arm exercise, and they're very good too. And then one abdominal breathing, which is you put your hand on your abdominal and you breathe, then your abdominal up. When you breathe in, your abdominal up. When you breathe out, your abdominal down, right? I show another video as well, okay? But today we just focus on the acupressure point. So this abdominal breathing is important too, and I suggest all my patients to do it before they sleep, right? So all this 3, 2, 1, you can do it before sleep, and I do it often. And don't forget that you can do this ear massage as well. I show it on the other video as well. So make sure you do ear point every day, because I do it every day, all right? All the ear, right? That's it for today, and I would like you to join me tomorrow. Tomorrow we're gonna have another topic of live video. I'm not quite sure what it is yet. I'm gonna check my notes. All right, I'll see you tomorrow, and I love you all. Stay awesome. See you. Bye bye.